Chapter 14, Mental Disorders. The physical symptoms of alcohol abuse are frequent infections, hypertensive uh, episodes, uh, GI problems, seizures, withdrawal issues, um, whenever they've been away from alcohol briefly. Prolonged use can cause cirrhosis of the liver, pancreatitis, neuropathy, so it's very damaging to the body and to tissues. And then there's also treatment for alcohol abuse is detoxification, and a lot of times that's an inpatient type process. Psychotherapy, group therapy, the 12-step program is very well known, not only for alcohol um, abuse issues, but also for other things it's used. And abuse is something they may give that will actually cause vomiting if they drink after taking. Um, Relapses are very common, and most people who abuse alcohol have to totally stop drinking permanently. Drugs and abuse can modify their mood or behavior, or sometimes harm the body when it's abused to a certain extent. The main classifications of drugs you see here are stimulants such as amphetamines, ecstasy, cocaine, opiates such as heroin, hallucinogens, LSD, and then inhalants, which are considered volatile substances, cannabinoids, marijuana and hash, steroids, tobacco, and prescription drugs. Um, During drug abuse, tolerance to schizophrenia is a group of disorders that may be the result of chronic mental dysfunction causing different types of impairment. So it's not necessarily just one. It's often very disabling. Um, Many people have difficulty just managing day-to-day life in things like finishing their education, maintaining a job. Relationships is another problem. And the symptoms usually appear in the mid to late 20s. They're usually not a sign of before then. Um, and they have positive manifestations or excess or distortion of normal function, or negative, the loss of normal function. So it kind of goes two ways there. Drug for schizophrenia, the testing or psychological testing, some brainwave scans, PET scans, and so forth. Treatment, antipsychotic drugs. These are long-term treated patients, and so medication is something they have to stay on. Typically, family members usually have to be involved also because they can kind of lose a sense of reality. Close relatives are also 10 times more developing the schizophrenia themselves. Bipolar disorder is a major affective disorder that causes abrupt mood changes from hyperactive or manic, and used to be referred to also as euphoric state, to a depressed state. Symptoms are rapid speech, and this is during the manic phase, rapid speech, frequent changes of topic, minimal sleep, uh, excessive energy, impulse choices, and delusions or hallucinations. Um, the person can remain manic for weeks or months before cycling into depression. Symptoms during the depressive phases are being sad or indifferent, slow thoughts and speech. They avoid communication and basically lose interest in a lot of things, including even an interest in eating. Sleep disturbances, they may have feelings of guilt, and they may also be at higher risk of attempting or succeeding in suicide. Drug treatment is usually things like lithium during an acute phase. Then there's Tegretol and valproate sodium helping to stabilize the manic episodes. However, if they are given antidepressants, there is a risk of also triggering them into a manic episode. Psychotherapy, encouraging them to be self-responsible and to set goals and establish limits. In major depressive orders, this is not similar to the manic and hypomanic episodes or the bipolar episodes. It can be triggered into a reactive depression. So mood disorders by one or more depressive episodes. So clinical depression, at least one or two episodes. Diagnosis, medical, psychological assessments, distinguishing between different types of depression and simple life stress. The mood has to be, or depression has to be prominent and persistent for at least 2 weeks with at least 4 of the related symptoms. Symptoms of major depressive disorder are empty or heavy feeling inside, vague sense of loss, self-blame, remorse, guilt, lose their self-esteem, have trouble sleeping, insomnia or excessive insomnia, loss of concentration or interest, and social withdrawal. And this can take place over a matter of days. They are also at a risk potentially for suicidal thoughts. And it does typically have a biological basis and a family connection to that also.